Eating More Lifestyle segment is sponsored by the Maryland Proton Treatment Center.
Well, the Maryland Proton Treatment Center is the first and most experienced proton center in the region. So joining us is the chair of the Department of Radiation Oncology at the University of Maryland School of Medicine and the executive director of the Maryland Proton Treatment Center, Dr. William Regine. Well, thanks for joining us. So in the middle of a pandemic, what advice do you have for those newly diagnosed with cancer?
Well, I'll tell you, don't delay getting cared for. And
Okay.
one of the challenges during COVID is the fear of coming to hospitals or coming to a healthcare facility. And I can tell you for sure, it's probably much higher risk of getting COVID for a patient to go to a supermarket than to come, say, to the Maryland Proton Treatment Center, where we have all of the safety protocols that one should have to prevent exposure to COVID. And remember, the best chance to cure cancer is when it's earliest and when it's smallest. And that's one of the big challenges we have. People need to overcome that fear. We don't want people delaying their cancer care. And especially with proton therapy, it's particularly useful when the cancers are earlier because you can focus the radiation and minimize exposure to surrounding tissue to other radiation doses you get with standard radiation treatments.
That makes perfect sense. Are there some cancers that require more urgent care than others?
No, all cancer is serious. So one, you should be undergoing your screening for cancer. Don't delay getting your PSA checked for your prostate cancer, your mammograms for breast cancer, and colonoscopies for colon, right? We do all those things, diagnose cancers early. We see early cancers, we can treat them better, especially more effectively with proton radiation therapy.
Okay, now do you have any advice for people who are diagnosed with cancer a second time?
Yeah, so interesting. More and more patients are doing well because some of the improvements we've had with chemotherapy and immunotherapy, that they're developing a recurrence or a second cancer in an area that's been previously irradiated. Of the over 2,500 patients we treated at the Maryland Proton Treatment Center, at least a quarter of them have been patients who've undergone what we call re-irradiation. And that is particularly useful to be treated with proton radiation because, again, it's a form of radiation that you can precisely deliver all the dose without additional exposure to tissue that's already been radiated previously, and therefore it becomes at even higher risk for some sort of radiation injury or damage.
Okay, great information. Thank you so much for the amazing work that you were doing there, Dr. Regine. We appreciate it.
Thanks for having me, and please make sure people go out and get their cancers taken care of. We can cure a lot of those when we see them early.
For sure. Thank you.